Good afternoon. I'd like to thank you all for joining our resource management tool webinar for the life sciences industry. Today, Pharmaca consultant Andy Grubb is going to walk us through a presentation and live demonstration of the tool and field any questions that you all have. So please feel free to use the GoToMeeting interface to ask any questions at any time during or after the presentation. So with that, I will turn it over to Andy.
Great, thank you, Billy. Thanks everyone for joining. So my name is Andy Grubb. I'm a consultant at Pharmaca Consulting, and this is the Insights webinar for Intrinsic's resource management tool. So Intrinsic and Pharmaca are a pair of companies. Here's a slide about a little bit about who we are. Pharmaca Consulting is a consulting company that I work for. I've been there for many years. Kind of biopharma experts, that's all we deal with, are pharmaceutical companies, biotech companies, and we're about the people. We're very normal people. We try and be relatable and easy to work with, yet experts in what we do, so we can really deliver for you. We've been doing this for about 12 years, the company, and through our expertise and a lot of the work that we do, over and over again, we were asked to work on CTMS projects as well as resource management projects, just repeatedly through all kinds of different clients, large and small. And it became pretty obvious to us that we could offer something better than what was available in the market. So from that came Intrinsic Clinical Systems, which is kind of a sister company to Pharmaca. Pharmaca is for consulting. Intrinsic is for the actual products that we're marketing. So what you're going to see today, the Insights Resource Management Tool, is an Intrinsic product. I'm a Pharmaca consultant, kind of the crossover there. I've done a lot of work with resource management. I helped inform how we built the tool, and obviously I'm doing the webinar today. So that's the relationship between the two companies and kind of who we are. So why did we think that we could do better? Why is Insights different than what's available? Through a lot of our different projects that we did for other clients, it became really obvious that a large portion of the features available in current resource management tools aren't really ever used. They're bells and whistles that cost a lot of money that you just don't need. So we decided to build Insights with a more narrow view. So it's really only the things that you need, not all the other stuff that you don't. It's designed so that the workflow is smooth and easy to use, and that the output, right, the output is clean and easy to get to. The deliverables are easy to find. The UI is very easy, very kind of obvious, and we've decided to be very disciplined about how we add new features. So we're constantly talking to clients. Things that are requested over and over again will work into future releases, but we really try not to add a ton of minute customizations that might never get used or hardly ever get used. And the whole package is actually really easy to implement. It's very quick to stand up and get running. So, if you're doing resource management in-house, you are probably used to seeing something like this. Excel worksheets, tabs, files, page after page of calculations, conditional formatting, cutting and pasting, month after month. Maybe some macros built in. Trying to keep all this straight, formatted properly. The file has to live somewhere on someone's machine who may not be there in a year. It's possible to do resource management this way. You can do it. It's just a giant hassle to try and work this way. The other end of the spectrum is the million-dollar solution. So these off-the-shelf tools that cost an arm and a leg just to buy. Plus, you have to have the team to run them. So it's a suite of people to program them, to actually enter the data, to pull the data out, to report on everything. I was part of a team like this at a Big 5 pharma company, and it was a massive enterprise just to kind of keep the monthly process going. it was a giant hassle. There were good results at the end of the day, but it was a very expensive, very large team to run. So the problems with these kind of two ends of the spectrum, the current solutions, if you're big pharma, you've seen that these off-the-shelf solutions have just become incredibly complex. You need huge teams to run, and of course they're very expensive, right? They're over $1 million to buy, not to mention the upkeep. And you need very specialized knowledge to even just program your algorithms into them. If you're more of a mid-sized company, you might still have all those Excel files that you saw. You might have one of these off-the-shelf things. But really, neither of those solutions works for what you need. And then for the smaller companies, you may only have, a couple studies or a couple drugs in your pipeline. You might have lots of new people. Do you have any idea what everyone's doing and what you're going to need next month, next 6 months? You probably don't. So our solution, Insights, what can that do to fix these problems? So if you're big pharma, you can actually get, the full featured resource management solution, right? So pretty much everything that you're going to use anyway, but it doesn't have a huge price tag. You don't need the team of 50 people to run it, and you don't need people with special coding knowledge to be able to program it. If you're more of a mid-sized company, you can completely get out of that, Excel game. You don't need the cut and paste Excel formulas month after month. You get the full resource management. You don't have to pay the millions of dollars. And then, if you're a smaller company, you get a pretty quick and easy way to see where everyone is, what they're doing, and what you're going to need moving forward, probably for the first time. So, it's really the whole process behind the tool. It's really about answering questions. So, you can see the main question is always, what's my demand going to be? What am I projecting I'm going to need? The tool takes your book of business, runs it through your algorithms, and spits out your projected demand. So you can see it sliced and diced, by role, by therapeutic area, by whatever hierarchy data you want to see over time, into the future. And then the follow-up question to that is always, do I have the people to meet this demand? And again, the tool can take what you're projecting and allow you to assign people to each of the tasks based on their capacity, so you can actually answer that question. So you can see where your people are assigned, in the future, and see where your gaps are. See how many FTEs you might need to flex up or down to, either fill a gap or, if you're overstaffed to work the other way. So how does it work? This is a screenshot from the tool itself. I'm going to step through a live demo in a minute. I just kind of wanted to talk about what you're going to see so everyone understands exactly what it is that they're seeing. So this is the first report that you get inside the tool. You load it up, it runs the algorithms, it displays this. So this is your demand projection. It's very easy to use. It's very easy to run. There are some kind of initialized settings that you need to set up. The first time through, you have to set up which activities you want to track. You have to set up your algorithm numbers. We have industry standard versions of all of these that you can use. If you've been doing this on your own, excuse me, you probably already have some of those. It's easy enough to enter yours into the system as well. It's easy to change whenever you need to change them to. But you need to kind of initialize the setup. After that, you simply upload your data. So this is your book of business, your book of work. This can be a CSV file that you pulled from whatever system you track it in. I'll show you an example of that in a moment. If you have Project Server, it can be connected automatically to automatically include the data. This is fully, there's a full API behind this, so it could be automatically connected to feed the data without any manual input. So once you initialize, you add your book of work, the tool automatically runs, and you see your results very quickly, which you'll see in a second when I load it live. And of course this is showing everything. We have a menu button up here where you can customize your report for what you're seeing. You can slice it different ways. You can pivot. You can filter. You can export. Pretty standard reporting type things. So that's the demand projection piece. Then there's the capacity planning. This is kind of the other side of the coin. This is assigning your people to work. Again, there's the setup where you add your employees. So just a very simple listing of who all your people are, what their roles are. You can come into the tool here, step 2, you assign them the tasks, and we'll step through this in the demo. It's very simple to do, but you give your people jobs based on your book of business, and very easily you can see how many FTEs each person has been assigned based on the different tasks that you assign them and how much that work, how much work that will actually take to complete the task into the future as well. And once again, you have a whole set of filters, and you can change the date range and export images, all the usual kind of report customizations that you would expect. All right, so at this point, I would like to actually start the demo. So let me flip over here to the live site. Make sure we're logged in. All right, so this is our demo version of the Insights tool. It is built in Microsoft Azure, so it's in the cloud, secured by Microsoft, hosted by them. It's a Microsoft login. The database that houses the data is in their systems. It's in their cloud. The processing power, it's all theirs. None of this would be built on your systems. Not taking up any any system resources. It's Microsoft secured. If you already have an Office 365 account with them, it can most likely be federated with the tool, so you don't have an extra login that you need to remember. You simply log into your account. If your personal user has been added to the tool, then you would have access to it. So I have a couple different demo versions here. We're going to use the clinical development one today. So I click in, and you can see it's loading the data. So the first thing it's doing is it's loading up the book of business, and then running it through the algorithms for that we have in here for the demo. Just take a couple seconds, and then it will spit out our first report. This is actually a fairly decent size book of business that I have in here for the demo. So here you can see your demand projection over the next couple years. It's pretty simple to read bar chart. You can see the FTE numbers across the top. This is for everything. This is the entire book of business, your whole organization. If I hover over any one of these colors, you can see the breakdown. This is clinical research for June and how many FTEs it takes. I have a key over here to show you what each of the different colors are. So this is sliced. If I click on the menu at the top, this is sliced by organization. It's also sliced by department. The exact same demand numbers, but now you're seeing the different departments that the work is categorized in. This is your work breakdown structure. This can be anything dependent on your organization. These are just the demo versions. The view that I prefer is the by position. So this is the final slice. Again, the exact same numbers. However, this is broken out by all the different roles that we're actually modeling in the tool. You can see, the green at the top here is this is the CRA demand for each of the months. And if I were to just click on that bar, it opens a pop-up where I can see a very specific breakdown of the different work items, the activities that's going on, complexity, and then the actual FTE, like how am I getting to 3265? It's from this column summed up. So these are all the different projects in my book of work that are active in January of 2018 and how much demand it's generating. You can see that for each of these segments in here. So that's actually pretty neat. I mean, that's my entire organization rolled up, all the demand that I'm projecting for my entire book of work out a couple of years. So this looks great. There's really not much I can do with this, however. So let's kind of narrow it down a little bit. So instead of showing my entire book of work, I'm going to show just a single study. If I unselect everything and come down here to this one. All right, so now you can see my demand, my projected demand for a single study. You know, again, you have the same feature where I can hover over any of the segments and see the numbers and a little bit more detail about them. So this is what I would need to run this one study. So this is actually pretty useful. If you're a project manager or something, you can get a look at what it's going to take to run your study. Very quickly, kind of drill down to this level. So now what I'm going to do is, inside this study, I'm going to filter just on one role. So click on the CRA here. Now I can see, again, with just a couple more clicks, exactly how many CRAs I'm going to need for this study. You know, over the next couple months. So this is very useful. This is actionable, right? I can see that clearly, I think with just one CRA, I'm going to be able to cover this work into 2019. You know, and then you can back it up. So let's, instead of just looking at one study for the CRA, let's look at all of them. So this is, you know, my entire suite of CRAs across the entire company. For my entire book of work, you can see that, you know, currently I only need 10, but in a couple months that's going to double and then triple, and I'm going to need that for another year, more or less. So this is a very quick way to get actionable data, how my organization is going to have to, you know, flex up its CRA capacity because the demand is coming. You know, late 2017 and 2018, I'm going to need a lot more CRAs. So that's kind of a really powerful tool to get down to what you're going to need for, and you know, include it for reporting purposes to work on your capacity for the upcoming, you know, however long your planning period is. So of course I can export this as an image, you know, to include in a PowerPoint report or something, and it really is that easy. Everything, I mean, this is functionality and kind of clickability that everyone's used to from using other kinds of tools. It's really very powerful. I can reset the whole thing, so all my filters, all my pivots, it'll just reload the book from the, you know, from the base level like we started with everything at the top. So while that's loading, let me show you an example of one of these book of businesses I'm talking about. So this is the one we're currently using. You can see that the breakdown here that we're using is therapeutic area, program, work item, which is essentially a study, and then the activities. These are the different activities that would go on inside of a given study. And again, these can be whatever your organization uses. These are just the ones that we're using for the demo. But the names of these, the actual text in these can be anything that you want. And then a very simple, you know, begin and end date for each of these activities. You know, this is probably a couple hundred rows of data in here. You know, for a very large book of business, it's going to be quite big. The system can completely handle that. There's a full-fledged database behind the scenes, you know, to handle as large a book as you have and as many algorithms as you want to include. The system can definitely handle all of that, and you know, in a very timely fashion. So there's really no delay when you want to load up a new book of business. So you can see that there's a drop down up here with this date. If I take a look at that for a second, these are all the different books of business that I've uploaded as examples. So you can see if you were on a monthly cycle, it'd be very simple to just, you know, give it a name and upload that given month. I have another one in here where I have removed 5 studies just to see what the difference would be in my demand. So you can kind of scenario plan by adding or removing, you know, changing dates, just making any change to the book really. You just add it as a different file, and you can very simply flip between 2 books of business using this drop down and see what the changes are. So that's a pretty powerful way to scenario plan. You know, adding a new book of business, if I move to the left here, there's a a menu bar that opens up. And these are first of all your different reports at the top, and then the bottom is the management area of the tool. So you can see in the scheduled area, that's what we're calling the book of business. Here's all my different books that I have. Adding a new one is as simple as just clicking the button, and choosing a file from my computer and adding it with whatever name I want. It's really that easy. It's also easy to remove something. You just click delete. Like I said earlier, this can be automated if you have a system that allows, an automated export of the data. Project Server is the one that most people use. This is fully API capable and can be connected to that. So these books of business can be automated. The input can be automated, and you never have to manually add anything. There are a series of other kinds of management options in here. So there is, I'm going to go slightly out of order here. I go into activities. These are the different activities that we're going to model. Again, these can be anything you want. I just simply have to click in here, and I can change whatever I want to change out of these. I can change the order they occur in. It can be as many as you need. There's my organization. So you can see all the different levels of my organization here. There's different departments that fall inside different organizations. And then here are all the roles that I'm modeling. Again, you can see it's very easy to add new ones. It's very easy to rename them just by clicking in the different boxes. You can change the names. This can be completely customized to whatever your organization looks like. There is the time allocations piece. So this is kind of the meat of the tool. These are the algorithms here. So this is a combination of every role and every activity that we're going to model, and then some FTE numbers for a low complexity, medium complexity, and high complexity activity. So these are the FTEs that we're generating when we create that projected demand in that first report you saw. These numbers can be anything you want. We have a set of industry standards that we use to start. If you have your own organizational numbers, they can certainly be included in here. It's very easy to change these. I can simply click in here and change this number, and it updates. I can add new ones. If I scroll to the bottom here, there's actually an import button, so I can import whole sets of these if I wanted to. It's very, very easy to manage. There's obviously no programming here. You just need to know the table and know what your numbers are. Finally, there's this last piece of management, this complexity rule. So the tool allows you the ability to kind of set up some logic to determine if a given study or activity would be a different complexity than normal. It always assumes a medium complexity, all other things being equal. But you could set up a rule here. If the therapeutic area is oncology, just as an example, maybe the complexity is high, or some other key. You can see there's some other keys and other values. Let's say that you are tracking number of patients or number of sites in your book of business. If the number of sites is greater than 10, maybe the complexity is high. Some kind of logic to that. You can set up a series of complexity rules, kind of trigger changes in your book, or changes in your algorithms, excuse me, to fire off at higher values or lower values if something was a low complexity. To really kind of make your algorithms more granular and a little more exact based on different rules that your organization might have. But together, all these different management pieces, this is the tool. So you would initialize these different things. You'd set up your allocations and your FTE values, and then you're just simply adding your book of business however frequently you want, and you can model as much as you want. All right, so let's move to one of the other reports here. So I'm going to show you quickly this timeline visualization. This is basically a Gantt view of the book of business. So that Excel file that I was showing you earlier, this is the same data but put in a Gantt type chart. So you can see all your studies and activities, on the left, and then the bars showing the different date ranges for each of those activities. And if I hover over any of them, you get a little bit more detail. And then I can collapse them if I wanted to just kind of see a high level when all my different studies run. But this is the entire book of business. So if I scroll down here, you'll see all the different activities that I'm tracking in my tool. This is kind of a neat view that a lot of clients have asked for. And again, I can kind of change the display mode or export an image if I wanted to include this in a report somewhere else. All right, so that's kind of the one side of the tool is the demand projection, right? Visualizing exactly what we're going to need in the future. The other side of it is this other report here, this capacity planning report. So now that we know how many FTEs we're going to need moving forward, let's get people working on them. So in the management section, there's an employees area here. This is simply a place to add in a list of all your people. So that's who all these folks are here that you see. I've added in a bunch of them as an example and given them all different roles. So these are all the database programmers. If I want to filter down here, I have all different positions in here. Let's just show the CRAs again. So these are all my CRAs that I currently have on the books. You can see there's a whole bunch of them in here. I want to assign them work. I want to see, who has capacity, who does not have capacity, and make sure that all my projected demand is covered, through the next however long, next year. So if I select Oscar here and click inside of his cell, it'll tell me a little bit about him. It'll show me that he works 100%, so he's a full FTE. Again, this can be changed in that employee table. I could make him, some partial number. And I want to manage his tasks. So I get a pop-up for Oscar with a little bit more information about what he's doing. He's currently not assigned to anything. Let's pick something for him. So if I pick this one study, you can see that it's a full FTE. This is 100% of his time to do this work. And I can schedule it for 1 month in February, for just February. So add that in. Oh, I didn't hit the button. Sorry. This one, February to February. Let's add task. There it is. So now you can see that Oscar has an FTE of 1, and you can see he's assigned to that study for February. But let's go back and assign him long term to that task. So I can go back in to the thing and let's assign him for a year, and we'll add it. So now we can see that Oscar has that full FTE assigned to him for an entire year. Well, maybe we know that Oscar is going on, he's going to take some time in June, July, and August. So I can go in, and at the bottom of my task here, I can assign him other. Let's say he's taking some paid time off. He's going to take 1 day a week, so that's 20% of his time. You can add that task right in. But he's still assigned to the study 100%. So you can see that now all of a sudden he's turned red for those 3 months. He's over-allocated. He's going to be gone 1 day a week, so that's 20% of his time, but he's still assigned to 100% study. So, with a few clicks of the button, you can very easily see where you're going to have unmet, work that needs doing, who is over-allocated, who is under-allocated. You can assign people to different tasks, across their duration, just for single months. It can be very broad strokes. It can be very granular. It's completely up to how you want to manage this. But it's a very powerful way to assign your people to work and then get a pretty good picture of exactly what they're doing at any given time. And again, like I said, you can filter and pivot and change the date ranges here. To see exactly what you're going to do, exactly what you want to see. You can export everything as an image to include in reports. So that's the other half of the tool. you're projecting demands, you're planning your capacity. You know, those two things fit together very well, and this is designed to be a fairly simple and straightforward way to manage those two things, yet be powerful enough to kind of give you the answers that you're interested in. So I think I'll pause there and ask Billy if we have any questions.
Hey, thanks, Andy. Can you hear me all right?
Yep.
Perfect. So we got a couple questions come in. The first question we received is, can we create algorithms and roles specific to our company?
Yeah, so that's a good question. I'll show that again here. So in the tool management section on the left side, you actually absolutely can do algorithms and roles. So there are, excuse me, if I go into the time allocations piece, these are the algorithms, right? So I can create whatever I want out of this. I can, you know, have this statistician, you know, this could be 10, and this next one can be 20. I mean, I can make these whatever I want. So these are custom algorithms for my organization. So just on the fly, I can make, you know, if I have some specific role that's custom to me, with very, you know, custom FTE numbers, it's very simple to go in here and modify what's here. Add a new allocation, you know, I can pick the role, I can pick the activity, I can put in the numbers. It's designed to be very modular in that respect. Again, these are all demo, you know, dummy instances that I've stuck in here, but these could be anything, and they would be anything. You know, for your organization, we would absolutely customize this, you know, with your list of roles, your list of activities, your FTE numbers. That's part of the initialization that would be, you know, setting up the tool for you.
Okay, great. Next up, we have, can we import timeline data into this tool? We use Project Server.
Yeah, so that's not by default set up that way. You know, in the schedules management piece here, you know, it's a manual upload. I'm clicking the add a schedule, I'm choosing my file, I'm uploading it. So that, you know, it's pretty simple to do on its own. It's also pretty simple to, if you want to check a scenario, you know, you make a change to your book, you upload it here. It's nothing official, it's something that you're playing around with that you want to see. You know, you might want to do that manually, but, you know, the tool being cloud-based is completely compatible with APIs from other systems. So if you're using Project Server or something else that would give an automated output, it absolutely can be connected. So, you know, that these books of business are updated, you know, daily, weekly, monthly, whatever your schedule is. Yes, it can be automated.
Great. Next question we have is, and I'm not sure if you had answered this, it was a kind of a follow-up to that one. Can importing be automated?
Yes. So it can be automated. Again, it will depend heavily on the system that you're using. You know, and the ability to craft that automated export. But I would say for the most part, it can, you know, pretty much everybody uses Project Server at some level. If that's the case, then yes, it can absolutely be automated, and others as well, but they're less common.
Someone said we don't have a CTMS where we have our list of studies with milestones. What do you recommend?
Yeah, so, you know, the book of business, a list of everything with milestones. You know, Pharmica has a kind of a sister tool or Intrinsic as well, has a sister tool that is a CTMS built in the cloud, just like this. It's kind of designed with the same reasoning. It's supposed to be easy and powerful and give you pretty much everything you need. That's one thing that I would recommend. I mean, there are many kind of CTMS light options out there that will give you more or less of what a full-fledged CTMS will do. If you don't have something currently, I would suggest you kind of talk to us about that. At the very least, we could tell you our experiences with the various systems and you know, whether they would be a good fit for someone of your size.
Great, and it looks like this is the last question we've received, so if we don't get anything else after this, we're going to wrap up for today. We have data from a CTMS, financial system, server, etc. Could we integrate this data with your resource management data?
Right, so different sets of data, yes. So it kind of falls along the same lines of importing the book of business data. You know, if your various systems have automated exports, we can probably connect to them via the API and pull them into the tool. Now, you know, what you've seen today is not the full feature set for this tool. There's a roadmap that we have where we're releasing new features every couple months that, you know, we've planned out. I believe the next release is in April, and it will include a headcount feature. So, you know, you can enter your headcount for your various roles and see that held up against your demand projection. Something else on the roadmap would be the inclusion of actuals. So time tracking data that you could include to actually, you know, have a planned versus actual report for past performance, and then maybe a way to tweak your algorithm comparatively. So, you know, all of those things, once they're built into the tool, if your data source can be automated, we can probably integrate it and include that kind of data. But yes, most of those things in that question are included on our roadmap, you know, for future releases in the coming months.
Okay, actually, so someone didn't use the interface. Someone actually just emailed me questions. You should be able to use the the GoToMeeting interface to ask questions, but we had a question. Can scenarios be viewed in comparison, either side by side or overlay, to show difference between scenarios?
That's a good question. So in a previous version of this tool that we had built in SharePoint, we actually could show them side by side. In this version, and I'll click into this missing studies book of business that I've uploaded. I didn't show that before. So this is the same book, but I cut out 5 studies. So, you know, you can't really see them side by side inside the tool. I could, however, you know, export all my data, and then show them side by side. But I can flip between 2 instances and kind of see the change at the moment. So I realize this might be a little tough to see, but you can kind of see how the bars shrink with the missing studies and then grow when I show the full book of business. So that the comparison feature is actually something that we've talked about including in the future releases. I think that's something that people ask a lot about, and is a really powerful thing to see the two books held up side by side to each other. So I would expect that to be included in the future. At the moment, you can't see them side by side. You can, however, pretty easily flip between a couple data sets and see the changes.
All right, so this seems to be the last question we've received today. Can the tool handle probability of success values at phase transitions?
That's a good one. Yeah. So yes, it can. You can use the complexity rules to include, you know, POS adjustments if you wanted to. It's a little bit trickier to kind of do the logic for that, but it absolutely can be done. We've built that into the tool, so, you know, it would depend on your internal logic, you know, what exactly triggers those POS adjustments. But I would say most likely we can construct some logic, you know, using these complexity rules to add that adjustment. You even if it's just a flat percentage, something becomes 10% less likely or 50% less, or whatever it is, even that can be included as well. So the answer is yes. It's not necessarily built in as a box that you just fill out. You kind of have to build the logic yourself a little bit, but yes, it can be included.
Okay, and then a follow-up to that is, so if so, can it simulate outcomes?
Simulate outcomes. So I'm not sure I understand. So assessing the likelihood across many different projects based on POS adjustments. I mean, yeah, it would change the demand values in the future if there are POS adjustments. If you adjust something down to 60% of its value based on whatever trigger in the future, then everything that hit would be 60% less or 40% less, 60% of its value, and you would see that. So I mean, that is a simulation, unless I'm misunderstanding the question. I think that is kind of built into it, yeah.
I think we got another question come in. If it could handle POS, could it run a Monte Carlo to simulate range of demand outcomes?
Monte Carlo, probably not run a Monte Carlo. We have not had that request yet. I would have to think about that one. Yeah, I definitely not out of the box. I don't think it would be impossible, but that would be, that would kind of be a module in here that we definitely haven't looked into building. So that would be kind of some custom work to build. But yeah, with the probability numbers and the book of business, you could conceivably run Monte Carlo on this, and see what the results were. That's something if you're really interested in. I would very much like to talk offline about that. So I would suggest you reach out to me.
Yeah, that's great. And like Andy said, we're always whenever we have requests like these, it's always good to talk to the person requesting and partner with someone who can help us get it right from someone in the industry. Okay, another question coming in: is your resource allocation optimal?
Is it optimal? I'm guessing that's the numbers that we have in here. These are, at the moment, these are all dummy numbers. They're definitely not optimal. We do have a set of kind of industry standard numbers that we've honed through the years that we've used with various companies. I think they're pretty optimal. They make some assumptions about the experience of various roles, and there's kind of a lot of dependencies some of them have. So I'm not entirely sure what you mean by optimal, but again, that's if you have some more questions about that, I'd like to talk about that kind of offline. I think that would be a good discussion, just to understand exactly what you mean.
All right, great. Well, that seems to be all the questions that we've received today. Once again, I'd like to thank everyone for joining. We're going to post this webinar online, and I'll send out an email notifying everyone when it's up. So if you enjoyed the content and want to watch it again, it'll be there. Or if you think someone else you might know in your network could benefit from seeing, please share it with them. So if anyone's interested in learning more about Pharmica or ICS and the work we do with the resource tool or any of our other areas, please reach out to myself or Andy. And don't forget to check our website for a list of upcoming webinars and anything else that's upcoming we post on there. So thank you all for joining us, and have a great rest of your day.
Thanks, everybody.